2020 Virtual Decatur Book Festival. We're happy you're joining us. I'm Allison Loudermilk. I'm the editor-in-chief of HowStuffWorks.com, an educational site that's called Atlanta home for more than 2 decades. How Stuff Works is sponsoring this session today along with Tall Tale Books because, just like you, we're committed to curiosity and critical thinking. Now more than ever, we believe that the world should be explainable, that curiosity should be rewarded, and that books are magical. It is my distinct pleasure to introduce Dr. David Sacher, the public health tour de force who has led Morehouse, Meharry, the CDC, the Surgeon General's office, and more. Along the way, he's tirelessly worked to address quality healthcare for all, not just a select few. His book, My Quest for Health Equity, comes at a time when diseases and conditions like COVID-19 continue to disproportionately affect the Black community and other people of color. His book, packed with leadership lessons from the front lines, could not be more timely. This evening, Dr. Sacher is here with veteran AJC reporter Jeremy Redmon to discuss his book, My Quest for Health Equity. Please welcome them.
Good evening, everyone, and thank you for joining us. Welcome to the AJC Decatur Book Festival. Dr. Sacher, thank you for doing this. In reading your book and discussing it with you the other day, and in preparing for this presentation, by the way, here's your book with all my note tabs on it. I've been carefully taking notes.
You definitely read it.
Yeah, I wanted to tell everyone that, in reading it and preparing for tonight, I realized, just how timely our discussion is that, given the coronavirus pandemic, the protest for racial justice, and the upcoming presidential election. So for our audience, let's give you just a sense of how things are going to work tonight. Dr. Sacher and I will talk for a bit, and then we'll open it up for Q&A. So start thinking about your questions now. I hope our conversation will inspire those questions. But for Dr. Sacher, let's start from the beginning, if you don't mind. We were talking the other day, and I want to hear from you about this, that you were introduced to disparities in healthcare at a very early age while you were growing up in Anniston, Alabama. Could you retell the story for us about your, very harrowing experience as a 2-year-old and describe how that helped you focus on health equity, which has been your mission?
Well, thank you, Jeremy. It's great to be with you. I was born and reared in Anniston, Alabama, on a 40-acre farm. There were 10 children, 2 died early. And when I was about 2 years old, I came down with whooping cough and became very ill. And I think my parents were really concerned that they were about to lose another child. But somehow they were able to get Dr. Jackson, the only Black doctor in Anniston at the time. They were able to convince him to come out to the farm to see me. And he did, and apparently he spent all day working with me. But when he got ready to leave, he told my parents that he didn't expect me to survive the week, but he also told them what to do to give me the best chance to survive. And they must have done a good job because I did survive. And later on, of course, the one thing I wanted was to meet Dr. Jackson. And so finally my parents told me that for my 5th birthday, they're going to take me to town to meet Dr. Jackson. I was excited. I never met him. He died shortly after that. And but by that time, I was determined that I was going to be a doctor like Dr. Jackson. Even though I had no idea what that meant or what that would require, I just knew it, that I was going to be a doctor. And so that was sort of the beginning of my journey.
Yeah, well, it was a very close call, I understand. And some of the detail was fascinating in that passage of your book where you said your mother was breathing for you at one point.
Yeah, according to my mother and my sister, there were times during the night when she was sitting up with me and I would stop breathing. And when that happened, she would breathe for me. And I assumed that she did pretty good artificial respiration.
break it down for us a little bit more, Doctor, just what was going on at this time, that African Americans did not have nearly the same level of access to healthcare as white Americans. Can you talk a little bit about that and why you were in such jeopardy?
Well, everything was segregated in Alabama at that time. It was unusual for anything not to be segregated. That included the hospital, and as I said, Dr. Jackson was the only Black doctor in Anniston at the time. So it was different. I remember my first encounter, that I remember very well with racism was when I think I was 5, but I had saved my money because I was going to buy an ice cream cone. I was excited. We went to town, and I slipped away from my brothers and slipped into the Rexall drugstore, I think it was. And they stopped me and they told me that they didn't serve, and I won't use the N-word, but that's the word they use. And so it was my first encounter. I had no idea that I wouldn't be able to buy an ice cream cone. So the experience with racism goes way back, but that was the one that stood out, the one that I remember most early on.
And Doctor, you write that one of your favorite quotes is from Dr. Martin Luther King Jr., and I quote, "Until a person finds something for which he is willing to die, then he is not fit to live." Now, you demonstrated for racial justice, including the opportunity to be served in segregated Atlanta restaurants, and you were arrested and you were jailed for it. As an aside, I'm impressed that you kept your grades up while you were in jail. How did the protests from your time compare to those today? Are they being led differently? And to what extent is health equity a factor in them? Because I imagine them really, they're broadly connected to everything, right?
Yes. I think the first major movement was the Montgomery Bus Boycott. My older brother, Robert, was a student in Montgomery, so I heard about what the bus boycott was like. But I think the main thing is nonviolence. Nonviolence was a strategy. It was something that was well thought out, and we were not afraid, but we were nonviolent. We were determined that we weren't going to fight back. We knew we couldn't win anyway fighting back. So, but we were well organized. We knew each other. The students got together during the week and practiced how we were going to behave downtown and what we would do if one thing happened to us or another. So I think the discipline was the difference. We all knew each other. We knew what to expect from each other. And so we survived a very difficult period in the history of this country.
Dr. Sacher, do you see health equity, though, among the issues that people are demonstrating for today? It's certainly about police brutality and a number of other issues, but health equity touches everything, doesn't it?
Yes, most definitely. Health equity is a major issue in this country. And of course, it's a major priority for our institution, the Morehouse School of Medicine. We believe that our major role in this country is to enhance health equity by educating physicians who are committed to serve in underserved communities. And so this goal of health equity is paramount for us.
And Doctor, I want to bring us to what's going on today with the pandemic. And you and I have talked about this, that nationwide, Black people are dying from COVID-19 at more than twice the rate of white people. And that's according to the COVID racial data tracker. Why is that the case? Is the disease exploiting these health inequities that we've been talking about and that you write about in your book, including, say, for instance, the lack of access to healthcare as well as grocery stores? Can you talk a little bit about that? Why are we seeing such a disproportionate impact on African Americans? It's also disproportionately affecting Hispanics in America, this terrible pandemic.
Yes. Mm-hmm. Well, we've been talking about disparities in health for quite a while now. And when I was Surgeon General in the year 2000, we released Healthy People 2010, the goals for the country for the next 10 years. And there were only two goals. One of them was the goal of enhancing the quality of life for people as they got older. And the second goal was the goal of eliminating disparities in health. And there were specific objectives as to what had to be done, including improving access to care, improving quality of care, getting more Black and Hispanic physicians and nurses, et cetera. So all of those things were a part of the strategy for enhancing health equity.
Yeah, and I would note as an aside, in covering the pandemic, that among the top 20 counties in the nation with the highest death rates, there are several from Georgia on there, and they have largely African-American populations that are majority African-American populations are being afflicted by this. I want to ask about the pandemic a little bit more here, Doctor. Sometimes, when I write about it and I'm interviewing families who've been touched by this, they are reluctant to talk about it. It's either affected them in some way, they've been sickened by it, or they've lost a family member to it. And this goes to something you've written about in your book, which is stigma surrounding an illness. In fact, I've talked to some people who've been shamed for coming out and talking about having COVID-19. How powerful is this issue of stigma, and to what extent is it a barrier, to healthcare? What can we do to overcome this?
Well, stigma can be a major barrier to access to care. In the book, I write about it as it relates to mental health, especially, because, and mental health is a major part of what we're dealing with now with COVID-19, the way people respond to it, the way they feel about experiencing it, and not wanting to talk about it. So the stigma is a big factor here, and I think it's something that has to be overcome if we're going to be successful at getting people to seek care as early as possible when they become ill. This is a very dangerous virus. We need to wear masks, and I think part of the reason that people don't want to wear masks is stigma. They feel a stigma related to walking around wearing masks. But without question, if we're going to conquer this virus, we're going to have to make some sacrifices. And one of them is the wearing of masks.
Well, let's put this issue to bed if we could. Do masks work? Are they effective in preventing the spread of COVID-19, Doctor?
All of the evidence is that masks work. They dramatically reduce the onset of COVID-19 without question. And the figures are significant. The reduction in people becoming ill with COVID-19 when they wear a mask as opposed to when they don't is significant. When the students go back to school, and we're struggling with that right now, many of them don't want to wear masks, and by the time they get there, like University of Alabama, within 1 week, 1,200 students were infected with COVID-19. And those are the kind of figures that we're experiencing throughout the country. We need people to wear masks. We need them to socially distance, at least 6 feet from each other. And we need them to follow the other directions as it relates to hygienes and things like that.
Doctor, we were getting ready for this discussion. We talked about a little anecdote in your book that you have Dr. Fauci is mentioned in your book. Tell me about your relationship with him and what kind of part he plays in your book. Well,
I've known Tony for a long time. When I was Surgeon General, I actually lived on the campus of NIH. That's where the Surgeon General's home was at that time. And I used to go jogging in the morning, and I'd often encounter Tony riding his bicycle to work at NIH. But I met him because we were in meetings together, and I remember when we had to make a very difficult decision, trying to get Congress to pass a law related to eliminating disparities in health, and in fact, to create an institute that would support that. And the one thing that was stopping us in our department, of course, was the feeling that NIH would not support that. So Harold Varmus, I think, Dr. Varmus won the Nobel Prize for some very important work that he did. But anyway, he invited me to come over to NIH when he was having his monthly meetings with his institute directors. And he wanted me to present to them the logic for why they should support this legislation. And I did. It was a great opportunity, which I took. And Tony Fauci was one of the, he was head of the AIDS program, and which was a major program then in the infectious disease unit, and was known for that. And I remember the meeting very well, and I remember Tony Fauci sitting on the front row. He's a great guy.
Yeah. What do you make of his sort of role today and all the attention he's receiving? Does this surprise you?
No, I think he's a courageous guy.
Mm-hmm.
He's a person of great integrity, and he cares deeply about people. He showed that in dealing with the AIDS epidemic. He listened to people all over the world. He would go to the AIDS meetings every year, and he would generally speak, and then he would listen. He's that kind of person, and I think he's quite reliable, and I get the impression that the American people have come to realize that.
You also write in your book about the importance of science, that that this is essential for policymaking. And as we've discussed, Doctor, there's a growing criticism right now that the Trump administration has been politicizing the CDC, which you once led, as well as the FDA and the Department of Health and Human Services. Now, we've heard the president repeatedly tout hydroxychloroquine, as well as convalescent plasma therapy, though both have not been conclusively proven as effective treatments for COVID-19. And as we talked, the FDA commissioner has been accused just recently of grossly misrepresenting the data about the effectiveness of plasma therapy. And then also we heard that the CDC just abruptly changed its guidance, that recommending that people without COVID-19 symptoms should abstain from getting tested. And scientists have warned that that is a grave error. So I want to hear what you make of all this, given your background, that you once led the CDC and you were involved in some of the highest levels of federal healthcare policy. Tell me about your concerns.
Well, 3 other former directors of the CDC and I wrote an op-ed piece in the Washington Post about 2 months ago, I believe. And we expressed our concern that the politics was getting in the way of the science and how we thought it was affecting the CDC. Feel very strongly about that. I became director of the CDC in 1993. I represented the country at the World Health Organization meeting. The CDC is held in very high esteem all over the world. People trust the scientists there. They trust the science that come from the CDC. And so I was really concerned that politics should not be trying to dictate the science as it relates to the CDC. The science must dictate the policy, which is recommended by the CDC. So that's been my concern, and that is still a major concern that not only I have, but other former directors also.
If I could, I want to put you on the spot, Doctor, and just kind of get your prediction in the months ahead. Given the pandemic, what do you expect we're going to see and experience with COVID-19 to the rest of this year? There's a lot of discussion about the possibility of another wave of infections during the fall while the flu is hitting. Meanwhile, there's a race for a vaccine. The Trump administration recently announced that states should be preparing for a vaccine to start, as early as the beginning of November. What do you think is going to happen?
Well, my greatest concern is that we're going to have wave after wave of this virus impacting people throughout the country. My greatest hope is that we will be able to develop a vaccine within the next few months, hopefully by the end of this year. That would be the best thing that could happen, would be to develop an effective vaccine. And some great work is going on, and a lot of investment has gone into developing a vaccine. So it could be that we'll be fortunate enough to develop a vaccine. I wouldn't overstate the likelihood, but there's the hope that we will be able to do that. It's not easy to do. Vaccines are difficult to develop. We've never developed one within a year. It's usually 3 to 4 years. So the likelihood of developing one would be, by the end of this year, would be low, and yet it's better than it's ever been because we've invested more in it.
Yeah. We're also seeing China and Russia, of course, right now developing their own vaccines and testing them out in the population. There's some concern about whether those have been thoroughly vetted and reviewed yet. I want to shift gears a little bit here and talk about leadership. That's a big, important part of your book, Doctor. And you and I talked about this before, is this notion of failure, that actually failing is something you can learn from and become a better leader. And the example you used was when you were trying to merge a hospital and how difficult that was in Nashville. Can you talk about that and the principle of failure and how that plays into leadership and becoming a better leader?
Well, it's not easy to describe the very complex situation in Nashville, especially the way it was when I became president of Meharry. And the New York Times had projected that Meharry Medical College was going to close. And because of financial problems, because of the patient care situation in Nashville, where Meharry did not have access to the funding that came with patient care. And that was a major problem. I believe the debt was like $25 million when I became president. And to make a long story short, we were able to get that debt forgiven because Meharry had provided a lot of care without reimbursement. So Congress, President Reagan, and others decided after reviewing the situation was that that debt should be forgiven and Meharry should be allowed to go on with its program of educating Black doctors. At the time, Meharry had educated, trained over half of the Black doctors in the country. And that also applies to doctors of dental care. And so it was played a major role. So fortunately, and I give credit to the role that President Reagan played and the role that Congress played, and finally deciding that that debt should be forgiven. So that happened, I believe, in 1994, and we moved on from there. But it was a very fortunate development, not easy. But I think you were talking about the fact that we then tried to integrate the hospitals in the sense that we would be sharing the hospitals. And I made a presentation before the Rotary Club in Nashville about, why it was so important for us to be able to share. And we even proposed that as opposed to building a new county hospital, the one that was there was really struggling, that we moved the patient care to Meharry's campus, invest in the hospital there, and solve two problems: the problem of having a hospital for patient care and the problem of Meharry's financial situation. It took over a year, and finally the hospital board voted in support of integrating the hospitals. And so today, the Nashville City Hospital is on Meharry's campus. And so the funding flows to both institutions. Vanderbilt is the other medical school, of course.
Yeah. And then I think, implicit in this discussion about hitting obstacles and failing and then succeeding is humility, right? And that's an important aspect of leadership. Can you talk about that, just how you learn the importance of humility through your work?
Yeah, you notice I sort of skipped that part about the failure, didn't I? But that was a major part of it. The first proposal that we submitted to the Nashville City Council was turned down. And we had a board meeting coming up soon after that. And we had worked so hard to get that proposal in place until I thought sure that the board was going to fire me, since we had failed that. And so I was looking forward to it. But when I presented to the board and explained to them what had happened, they asked me to leave the meeting, of course. And when I got back, they said they had decided that they wanted me to take the ball to the end zone. So they asked me to stay on and continue to work. And within a year, we had gotten approval for the hospital mergers.
There's a great anecdote in your book, Doctor, and we hadn't talked about this before, but I'd like you to expand on it. And it's this you're about to get ready for a big interview for a very important job, and you notice that there is secondhand smoke going on in this building where you are, where these students can breathe it, and it so incensed you that you were distracted by it, and you told your interviews about it, and it actually helped you land the job. Can you talk us through that? It was fascinating.
Yeah, part of what we did in Nashville was to support the teachers in the schools and the community. So once a month, I would spend at least a half a day at the elementary school. And I would sometimes have the students come out in the hallway, and if they had a deficiency in reading or something, we would work with that. And then I noticed that I smelled cigarette smoke. And so one day I asked the students, I said, do I smell tobacco smoke? And they said, oh yeah, Dr. Sacher, the teachers smoke in the room right down the hall. And I couldn't believe it. But it turned out that the system that was supposed to take the smoke out of the building was not working. So it was a combination of the fact they were smoking, which is a bad example for the kids, but also that the smoke was not escaping from the building. So it happened to be the same day that I was supposed to get my interview for directorship of the CDC. It was not a position that I had sought. Somebody had recommended me. But I'd gotten interested the more we talked about it. So I went back to my office, and as soon as I got back there, the phone rang. It was the interview team to interview me. And when they started interviewing me, just about every question they asked me, I would go back to the smoking and the kids being exposed to tobacco smoke at that school. Regardless of what they asked me, somehow it always went back to these kids are being exposed to tobacco smoke at a very young age. It's a bad example. It's bad for their health. And so it went on like that for almost the whole interview. So I told my wife when I got home that I just blew that interview.
Right.
And the next day, Dr. Philip Lee called me and said, David, that's one of the best interviews I have ever been a part of. He said, you did a great, I was really surprised. But it taught me a lesson that sometimes people want to hear how you feel and to know what's important to you.
I want to ask you something personal about your life. As you talk about the importance of taking care of yourself, and for you, it was long distance running, how you maintained an equilibrium. Tell us about how that helped you function and stay kind of level-headed while you were juggling all these responsibilities in your life. That's really, I think you even said you like spend 2 hours in the mornings getting ready and taking care of yourself before you started your day. That's a lot of time. But in reality, it's not if you think about the 24 hours in a day, right? But talk about the importance of that and how it helps you succeed.
Yeah, I don't know if I always spent 2 hours, but well, I'll tell you what I do today, and that's a carryover from the years past. Get up about 5:30 in the morning and go out. Now walking, it used to be running, but now it's walking for about an hour. And it's really served to keep me in good shape. I'm not an athlete. I ran track at Morehouse. I ran distance. Then when I got to medical school, the first 6 months or so, I thought I was too busy to be physically active. And the stress was great. And I realized one day that what I'm not doing is I have not continued to be physically active. So I started again to walk and then running. And that's the rest is history. Since that time, I have been physically active on a regular basis. It's good, not just for me physically, it's good for me psychologically. It really helps me to deal with stress.
Yeah, elaborate on that point though. To what extent, that exercise and that taking that time for yourself is helpful mentally for you? Could you, as I agree with you, I have the same thing. I get up in the morning and I do exercise before I start my day. And for me, I feel like it gives me energy to do the writing and reporting I need to do. Can you elaborate on your point there, Doctor?
Yeah, I certainly feel very strongly that the physical activity energizes me. It helps me to think. I discover answers to questions while I'm out there that I otherwise would not discover. I solve problems, but basically it's energizing, and it helps you to think better. And so it's been a part of my life ever since that time.
And Doctor, I imagine, I'm interested in maybe people who are tuning in are curious. What was your relationship like with the Clinton administration when you were serving in the government role there? What was that like?
Well, I think it was a good relationship. When I was director of the CDC, one of the first things that happened was a commission had been set up to study the Tuskegee study. I don't know if that rings a bell, but yeah. That's where the 400 Black men had been studied as if they were being treated for syphilis, but they were not being treated, just studied. So when I got to the CDC, the commission that had been set up to look at that study reported to me. They had finished their work. And it was very clear. Their recommendation was that President Clinton, the president, apologize for the Tuskegee study on behalf of the American people. And so that very same evening, I picked up the phone and called Washington, called Donna Shalala, who was the secretary, and then we both called the White House, and President Clinton was there, and we spoke to him about this commission report that had come in, recommending that there be an official apology on behalf of the American people for the Tuskegee study. And he agreed that we should do it. And I believe it was May 17, 1996, in the East Room of the White House when the apology took place. It was my introduction to President Clinton, because we did this sort of together. We even had the survivors of that study come up the night before, and we had dinner with them. Vice President Al Gore was also involved with this. So, but that was sort of the beginning of our relationship. We didn't always agree, I should put it like that. There were a few times when we disagreed, but I thought for the most part, he's very supportive of my work at CDC and as Surgeon General. One of the things I mentioned in the book, of course, was that President Clinton had said that he would support legislation that would allow states to sell certain kind of drugs that people would use, partly medical, but they were illegal in a sense too. So we were gonna get Congress to pass legislation that would make them legal. And we had agreed on that. And the day before is, we had, the press was there. We were gonna announce to the press that that we were gonna recommend a change in the laws. And just as we were waiting, I got a call from the White House saying that President Clinton had changed his mind. And that was because somebody had recommended that it was gonna work against him politically. This was 1996. And so he would be running again for president soon after that. To make a long story short, I was both Surgeon General and Assistant Secretary for Health. As Assistant Secretary for Health, I was a part of the administrative chain, and I had to support whatever the administration decided. But as Surgeon General, I was supposed to speak to the American people based on the best available science. And so that's what happened. I left that room, and from then until several months later, I went across the country talking about why states should pass their own laws allowing for this change. But as a rule, President Clinton and I think, worked very well together on those things that were really important.
You traveled across the country. You also traveled abroad, and you tell a really fascinating story about going to another country and noticing high levels of teenage pregnancy. And it dawned on you that there was a cultural difference in this country. And it was an uncomfortable moment for you, I know, because you were trying to do the right thing. Can you explain that? What was going on? And how serious this issue is.
Well, I'll try to make it brief. This was Malawi.
Yeah.
And I had actually gone to Africa with the YMCA, and we were actually dealing with helping to drill wells so that there would be safe water for people to drink. But I decided that while I was over there, I would make a side trip to Malawi, because the president of Malawi, who was a physician, had graduated from Meharry Medical College, and he had made a major donation to Meharry. So I wanted to go meet him. His name was Hastings Bunda, and I wanted to thank him for his support and tell him how proud we were of him, because he was then president of the country. Mm-hmm. He wanted me to see the hospital that he had built. It was the Queen Elizabeth Hospital. So members of his staff took me to the hospital. 250 bed, beautiful hospital. It was a Queen Elizabeth Hospital. So I assume that Britain contributed something to the hospital also. But at any rate, what I noticed was that 9 out of 10 of the patients who had delivered were teenagers. So I raised the question with them. I said, don't you have a problem of teenage pregnancy here? And they didn't understand what I was talking about, because what I didn't realize at the time was that it was not they didn't see it as a problem. Because even at that time, I think women in Africa were still not being allowed to go to school past the 6th grade. So all of those things sort of came together. And I think when I complained about, I didn't actually complain, I just said I was surprised that all these teenagers were delivering and not staying in school and getting an education. Their culture was different. You know, a lot of the teenagers were getting married very early. Some of the men had more than one wife at that time. But that ended soon after that. And I think things generally in Africa now are much better when it comes to women staying in school and getting an education. But I mean, I didn't know the full picture, and I guess I wasn't supposed to know, because if I had known, I wouldn't have confronted it.
Right. Doctor, you mentioned the Tuskegee study, and I wonder, we talked about this on the phone the other day, with something so grave like that situation, to what extent do you think that reverberates into today, where African Americans may be distrustful of healthcare and not getting the healthcare they need in the middle of a pandemic? Do you see a connection?
Oh, I do. Unfortunately, I think the apology was made in a very sincere manner.
Yeah.
And I think President Clinton, even on that day, said that he would hope that African Americans and other minorities would participate more in studies, because it was important for everybody's health. But there are people who've heard of Tuskegee. They don't necessarily know the details. They just know that a group of Black people were taken advantage of, deceived by the government. This was actually the Public Health Service. And so we haven't quite gotten over that yet. And in part because we still have so many problems with healthcare. People have trouble getting access to healthcare. Many people don't have a personal physician. So there are several problems, and you add that to the fact that they've heard of a time when there was a Tuskegee study. So it's not easy.
And in fact, kind of related to this, Doctor, something you write about is part of the health inequities we're talking about are driven by lack of access to grocery stores with healthy fresh fruits and vegetables, which can lead to diabetes and obesity. These so-called food deserts that we write about. This is a real thing, right?
Oh, yes, definitely. There are communities where it's not easy to access healthy foods, fresh fruits and vegetables. And it's interesting because in part, there are students who get nutritious foods at school. And when school is not open, they don't have ready access to nutritious food. So it's part of what we're dealing with right now. But basically, food deserts are real. There are many communities in which people can't readily access fresh fruits and vegetables. And so it's something that we have to continue to struggle with. We made some progress in the sense that the foods that were being sent to the schools by the Department of Agriculture at one time were not the healthiest foods. And I think we now have legislation which requires them to send healthy foods to the schools.
And I guess this kind of links back to our earlier point about how COVID-19 is disproportionately affecting African Americans and Hispanics, that underlying health conditions such as diabetes and obesity really make you at risk to COVID-19.
Definitely. Yeah, it's a setup really. When something like COVID-19 comes along, almost invariably it is gonna target, and I use that in quotes, the people who suffer disparities are most likely to suffer from COVID-19, either because they have diabetes or they have heart disease or hypertension. And these all lead to increased susceptibility to an infectious disease like COVID-19. We have a lot of work to do. We've set goals in the past, like eliminate disparities in health. We have not followed through. And we still have a problem in this country that whenever there's an election, it's almost like you have to start all over again. You know, I don't think that President Trump takes responsibility for commitments that were made by President Obama, and there's still debate, about the Affordable Care Act. It would be great if we could make some decision and stick to them until people got healthy or until everybody had access to health care. We're not there yet.
Yeah, you were saying that Trump is not living up to commitments made by the Obama administration or prior administrations. The Affordable Health Care Act, I think, is one that you mentioned. Are there others that you were thinking about as well?
Well, no, I just think generally there's a pattern that, in this case, of course, with President Trump, it's more serious than just not following through. I think there's an animosity to a certain extent toward things that were decided by previous administration, and that even hurts even more. Mm-hmm. And I think that's what we've seen in this case of the transition from Obama to President Trump.
Yeah. Well, on that note, you write about leadership and how it's a team sport, that science is important for policymaking. We covered that earlier, and that caring, you add, the word caring, so empathy, is one of the most important qualities of leadership. So what kind of leadership, do you think we need to get us through this pandemic that we're going through? There's a nationwide reckoning of racism going on at this point, and there's a struggling economy. We have an election coming up. What do we need at this point, Doctor? Prescribe us something, help us get us through this.
Well, one of the things that I talk about in the book is the whole issue of team leadership and how leadership is a team sport, and basically trying to say that no one leader can have all of the expertise needed to do what needs to be done, especially in the area of healthcare. So, and we're seeing that now when it comes to making sure that the best science is brought to bear on all of these issues. And of course, we've had a big problem with that. We've had the issue of politics overriding science. It's very dangerous. And it's the first time I've seen it to that extent. And I've been in government, spent several years in government, but to the extent that you have decisions being made politically that ignores the science and what would be dictated by the science. Excuse me.
I want to just tease out one part of that question, Doctor, to get you to elaborate, is this part about caring. And by the way, we're about 5 minutes from Q&A. So the audience, you should be thinking about your questions to get ready to ask Dr. Sacher, but I'm going to help sort of prime those questions. Is caring, right? So I think you're getting at empathy. And can you elaborate just on your point about how important that is as a leadership skill?
Well, at the Sacher Health Leadership Institute at the Morehouse School of Medicine, we say that we need leaders who care enough, two, know enough 3, who have the courage to do enough, and 4, leaders who will persevere until a job is done. So we start with caring.
Yeah.
When somebody asks us, well, how do you go about deciding which students to select to go through your leadership program? Number one, we want evidence that these are people who really care. They really care about people. They care about patients. They care about doing their jobs to eliminate suffering and pain. So it starts with care enough, but then you got to know enough too. And so we encourage students and residents to make sure that while caring, they're also learning what they need to know in order to solve problems. That can be the science. And then the courage to do enough, which can be difficult, but that's a part of it also.
While we're waiting for questions to start coming, Doctor, I wanted you to talk about an anecdote you have in the book, another fascinating one where there was a patient that was just really in trouble and was having all sorts of problems. He was combative, and the nurses warned you not to go in there. And you really wanted to go see him and talk to him. And you prevailed on them to let you in, and they said, we can't ensure your safety. And you went in and you saw him, and it wasn't pretty at first, and you had to defend yourself with the skills you learned demonstrating for racial justice. Talk to us about that story, because it gets at this caring, empathy aspect we're talking about.
Yeah, in fact, it is. I think it's because of that patient that I later became the first Surgeon General to do a report on mental health. This was a 17-year-old Black patient, young man, and this was our first day on what Case Western called behavioral health as opposed to mental health. But it was the same thing, basically. So one of the first patients we saw was this 17-year-old Black patient who turns out later had paranoid schizophrenia. And the nurses and everybody, they were afraid of him because he was violent. So when we went to his room, we just stood outside in the hallway, and the faculty person explained why we couldn't go in, that this patient was violent. And so after we left the room, I was just curious. So I asked the faculty person if it were okay for me to go back and visit with this patient at some other time. And he thought about it, and then he said, yeah, but David, you be careful. You know, this is a dangerous patient. So I was able to get the nurses to arrange for me to go in to see him. He was dangerous. I admit that he was violent toward me a few times, but I talk about why having gone through the civil rights movement and the way we used to train how we were going to fall if somebody pushed us down. So, defending yourself on the line was something that we were prepared for. But anyway, it didn't take long because he decided after a while, that he'd rather talk with me than beat me up. And so we started talking. I told him he asked me where I learned to fight. And I told him, I said, I'm not fighting. I said, I'm just protecting myself. And it led to my explaining to him about the civil rights movement, which he was very interested in. And I told him about how we used to prepare to defend ourselves and how we never hit back, but we protected ourselves. And so that was sort of the beginning of our having prolonged discussions. He calmed down, he started taking his medicine. And to make a long story short, by the time the rotation was over, he was able to go home on his medications. They had told us earlier that they were going to have to send him to the state institution because they couldn't control him in there. But he went home and really increased my interest in mental health and mental health care.
I love that story, Doctor. And that part I should mention, I thought was really interesting, is earlier in the book you talked about how you trained to fall by having your friends who were getting ready to demonstrate with you push you down the stairs, right?
Yeah, not just me. We did that as a group.
Yeah.
It
right?
was, let me just say, because people ask me sometimes now about the movement then and now and how it's different. And I think one way it's different is that it was a different time. We were certainly more disciplined because that was the only hope we had. You know, at that time, if we had hit back, we probably would have been killed. Not that there are not people killed occasionally now, but we went to jail, we went to prison, but we didn't get in fights because that was not the nature of the movement. We were disciplined. Dr. King taught nonviolence, taught it on Sunday in his church, taught it when he came to Morehouse to speak to the students. So it was a part of our approach to things.
Well, the questions are coming in, Doctor. So I'm going to start with one. If you want to get a drink of water or take a moment for yourself, I'll read it to you while we get started here. So it starts off, Doctor, many people don't take the flu vaccine, which has been around for a while. What makes us think that people are going to rush out and take a COVID vaccine that they believe has maybe been rushed to market? Well, that goes back to our point earlier about how the Trump administration is trying to, is already announcing to states to be ready to dispense this vaccine as early as November 1st, I believe. And that's been coming under criticism from scientists who believe that's really too optimistic.
Well, it's a difficult question for two reasons, but I'm going to try to answer it. One is things have changed even when I was from the way they were when I was director of the CDC. When I went to the CDC in 1993, we were trying to get the immunization rate up. The concern then was that children be immunized by the age of 2. That was the goal, is that, that every child be fully immunized by the age of 2 in terms of things like measles, mumps, and rubella. And we tried to figure out a way to increase immunizations in the Black community because this was a major disparity. And we ultimately were able to get the Council of Black Churches to work with us and somehow working with churches all over the country, they were able to get their members to cooperate in terms of immunizing children. And so the CDC actually reached this goal in childhood immunization, mainly because of the partnership that we had with the Council of Black Churches. I still believe that these kind of partnerships are important. People need to have people they trust, people they know and trust, involved in something as important as immunizations. And now as we develop a vaccine for COVID, we're gonna need a community approach to immunization. People need to be able to trust the system. And in so many cases today, they don't trust the quote system. And sometimes leaders can make it difficult to trust the system.
Indeed, Doctor. So we have another question here from someone who's tuned in is, what's the best way, this is a two-part question, what's the best way to advocate for family members when they're being treated or giving birth? So if you've got a loved one who's in a hospital and is delivering or is being treated for an illness, you see them, Doctor, I'm sure during the course of your career, family members who are well-meaning, they want to help. What's the best way they can advocate for those folks?
Well, it starts, I think, by listening to them and finding out what their concerns are and why. Sometimes just by listening, you can find out what people have been through in the past and why they have concerns that they have. Mm-hmm. And so my experience has been, it starts with listening and finding out just where, not just the patient, but the patient's family and others involved. What are their concerns? What are their worries about the patient? Sometimes you can learn more about the patient that way too.
And then the second part of that question, Doctor, is, they want to know, what about, what's the best way to normalize family fitness in the Black community? So this gets at this issue of health inequity and trying to boost the health of African Americans. How can we make exercising something that's a normal part of everyday lives for African Americans?
Well, one of the things I tried to do when I was Surgeon General, well, I did two things that I'll just mention. Certainly the schools, focusing on the schools and the fact that it was really important for physical activity to be a part of school. And because I remember when we did the report at the CDC, only 29% of schools were requiring physical education K through 12. So that's when the Surgeon General, I was not Surgeon General then, but Dr. Audrey Manley was. And so working with her, we came out with a report on physical activity, really emphasizing the fact that it needed to be a part of the school. It never became 100%, but there was a great increase in schools requiring physical activity of various kinds. Some teachers became very innovative in terms of having children be physically active in the classroom as a part of their learning. And I was really happy to see that. But we still have a ways to go in terms of physical activity and good nutrition. Those two things ought to be, number one, they ought to be modeled in the schools. And number two, they ought to be a part of the school, because that's the only place that some children are going to get healthy food today is to get it in school. By the same token, the only place where many children will have a safe place to be physically active is at school. So we've been really pushing that because there are many communities where there's no safe place to play.
Thank you for that, Doctor. Another question. So the questions are flowing in now quickly. This goes to stigma, which we talked about earlier. How can we eliminate the stigma of talking about or accepting mental health problems as a diagnosis among people of color?
Well, that's a very, very important question. Because of the stigma, many children who suffer mental health problems early don't get treatment early because people don't feel comfortable talking to anybody about the mental health of their children. So we as a society have created an environment that's not comfortable for people to deal with mental health problems. We need to talk about that more. We need to talk about it in school. We need to talk about it at church. And generally in the community, we need to get people comfortable with the fact that just as things go wrong with the heart, the lungs, the kidneys, and the liver, things go wrong with the brain. They always have and they always will. So the only question becomes, how will we deal with them?
Yeah.
And the earlier we deal with them, the better.
Thank you for that, Doctor. Another question is this is referencing how many people have lost health insurance because they've lost their jobs during the pandemic.
Yeah.
Do you see universal healthcare becoming a reality in the next 20 to 30 years?
Well, I have to confess that I really hope so. Yeah, I support universal health care. I just think that it's important for people to be healthy. It's important for the country to have healthy people. And so I just think that there should be no barriers to people getting the health care that they need. I know that that's easier said than done because we've been trying for a while. But I think it's in the best interest of the country for people to get quality health care, regardless of their ability to pay.
This goes back to mental health, Doctor, which I know you're keenly interested in, and it's referencing the very fraught situation when someone is having a mental health crisis and the police are called. So the question is, some calls to the police involve someone with a mental health issue. How can we get a proper response from those who need for those who need this help? How can we address emergency mental health issues that occur at home and get the proper response? So I think what this is getting at is, and you mentioned this earlier, and I think you wrote about it in your book, that we really put a lot of responsibility on the shoulders of police. And some of these encounters with people going through mental health crises end very badly. So what suggestions do you might have to help get the people who need the help in the right way?
Yeah, it turns out that I guess that the case in Rochester.
Yeah.
I know Rochester, by the way. I did 2 years of hospital training at Strong Memorial Hospital.
Yeah.
And so I know the city quite well.
This is the story of the man who they had placed what they call a spit hood on his
That's
head.
right. That's right.
And he died in police custody.
That's right. And that happens a lot because the police apparently are not trained to deal with mental health problems. And so I think one of the first things that has to happen is that we have to have a system that makes sure that the proper resources are involved when dealing with somebody with mental disorders. And so that means that somebody's got to be able to determine that this is a person who has a mental health problem, and we need to have somebody on site. It doesn't have to be another police person, or it could be a nurse or a physician assistant, but somebody who understands something about mental health. There are more mentally ill people in the Los Angeles County Hospital than probably any mental institution in this country, because people with mental disorders get arrested on the street and they end up in jail and often never get the care that they need. I think we're beginning to make some progress, and I commend those judges who made a decision that they're going to sentence more and more people to treatment as opposed to punishment. We really need that, and we need a system to take care of those people.
This goes to the education we're doing for doctors in America. So the question, doctor, is, are there enough medical schools today in the United States? And how many doctors of color are we producing today? And what trends can you point to for us? So do we have enough medical schools in America? And what is your sense of just how many people, doctors of color, are we producing through these schools?
Well, I don't think we have enough doctors, and I especially don't think we have enough doctors of color, because I think it does matter that we have an integrated force of doctors who understand the communities and the people they serve. And sometimes that's what's missing. Sometimes even the trust is not there because of relationships among different groups in the community. So I think we certainly need more doctors of color. I don't believe that physicians, however, are the only ones who can solve some of these problems. I think we have the need for people who are showing up in these emergency situations who are not just like there are police showing up when what you really need is somebody to counsel or to calm situations. Same thing is true with medicine. And we had I think I wrote about a project that we did here in Atlanta with Grady Hospital, dealing with mental health, and the fact that many of the patients with mental health problems were waiting hours and hours when they came to the emergency room. Many times they were waiting for the psychiatrist to get there, and many times they left, before the psychiatrist got there. So the program that we started put together an integrated team of people, and that integrated team included social workers, community educators. These were people who worked together to make sure that when people came to the emergency room, they got the care they needed and they didn't have to wait 12 hours to do it. That's been published in the Journal of Emergency Medicine, but I think it made a big difference. I think our people did a great job of enhancing the care of mental health patients in the emergency room and cutting back on waiting time.
We've got a few more questions rolling in, Doctor. Are you okay to ask a few more?
Yeah, I'm good.
We're already past the 7:30 mark, but if you're okay, we'll go a little bit longer here.
Okay.
So there's a lot of interest here, and this one is topical. This was just announced a few days ago, and this is about the award from Bloomberg to Morehouse. It was about $26 million, and the question is, tell me about your reaction to that. And I understand there's about $100,000 goes to students for student debt. What would you say to these students, and how would you encourage them to use that money in a meaningful way?
Yeah, I think the $100,000 for student scholarships.
Student scholarship, excuse me.
Yeah, which would prevent them from being in debt later. And that is important. I think the students perform better, you know, when they don't have to worry about debt and things like that. So, number one, I'm delighted that Bloomberg decided to make this contribution, not just to Meharry, but not just to Morehouse, but to Meharry and Drew and Howard, the four leading schools when it comes to producing Black doctors. And Bloomberg said he was concerned that there was a need for more Black doctors, and that's why he made the contribution. I was delighted about that. I remember when Bloomberg gave $300 million to Johns Hopkins within the last 10 years. And in fact, that's why the Johns Hopkins School of Public Health is named the Bloomberg School of Public Health, because he made that contribution. So I was really happy when he decided this time to make the contribution to try to enhance the force of Black physicians. So I think it was a good move, and just delighted about it. I think it will make a difference. Many of the students who come to medical school know that they can't afford it, they can't pay, so they get in debt, and every year they see their debt load go up. And I think they would perform better in school if they knew that they didn't have to worry about that. So Bloomberg has basically given that money so it can be used for scholarships.
We've got two more questions, Doctor. Well, actually, there's still more coming in. Well, let's take a couple more and see how we do. This one wants an appraisal from you of the Affordable Health Care Act and how it's done. Specifically, has the Affordable Health Care Act decreased health disparities for minorities in your view?
Well, let me say two things. One, I don't think the Affordable Care Act has been fully implemented. I forget the number of states. Somehow the figure 33 is in my mind. That may not be correct, but not all states have implemented the Affordable Care Act. And as you know,
talking about not expanding Medicaid.
Right, and President Trump does not necessarily support the Affordable Care Act. And so, but you're right, the big thing was expanding Medicaid, and there are several states that have refused to expand Medicaid. It's interesting, I guess Georgia, where I am, is one of those states where we are, people well in Georgia today. But it's a big issue, the fact that people cannot get care because their state is not one of those that's expanded. I think 33 states have expanded Medicaid, and so the other states have not, and people suffer because of that. I don't know, I just think we as a country need to decide that everybody deserves access to quality health care. And we need to work together to find a way to make sure that everybody has access to it. We're not there yet. I can't quite figure that one out. Almost every other country in the world assures access to health care. Almost every other country, but we don't.
This is an interesting question, Doctor. What keeps you up at night?
I don't stay up at night. No, I couldn't resist that one.
But are there things that are on your mind that you're worried about? And we probably talked about a number of them tonight, but that's what this viewer is apparently trying to patch into is, what are you most concerned about?
Well, certainly the one we just finished talking about, one of them, and that is when people don't have access to care. And when you're in a profession where people need help, you went into the profession because you want to help people, but the finances of it, there is no system that assures affordable care. And I'd like to see that changed, and hopefully over the next few years it will. Children keep me up at night. I really worry about children who don't have access to fresh fruits and vegetables, or who don't have a safe place to play. And I think we owe that to all of our children. Quality health care. So I certainly continue to worry about the care of children. I suffered as a child, even though I was very young at the time. I hate to see children suffer.
Doctor, thank you for that. There is one last question here from our viewers, and it starts this way. It's, what can we do to encourage more people of color to get into the medical and public health fields at an earlier age?
Well, it's all a part of the problem we have with education, the problem we have with school dropouts. Many of the students who would be physicians drop out of school in junior high school. So it's a much more complicated problem than just deciding to go into medicine. We need to figure out a way to make sure that kids decide to stay in school, and that whatever they want to do in life, they're going to be able to pursue it. Don't quite have the full answer to that question, because I think many people are dropping out of school too early and not even getting to the point where they can make a difference. And that's especially true of Black males, even more so than Black females. Our students are predominantly females. The Black male enrollment in medical school has not increased significantly since the late 70s. It has not. So it's a real problem. And we got to figure out a way to turn that corner, which we haven't yet.
Doctor, that was our last question for this evening. Is there anything we didn't cover, a message you'd like to leave with our audience before we wrap up tonight?
No, it's been great being with you. I've enjoyed interacting with you and the audience, and some great questions. And I look forward to continuing to pursue answers to these questions and others, because I think they're important, because I've lived them, I've lived the issues, and I hope we can continue to try to improve the answers.
Thank you, Doctor. For our audience, if you haven't gotten it yet, be sure to go out and get My Quest for Health Equity. It's a great book. You can see all my notes here. I used to write in books and with a pencil and everything, and then I realized I was damaging them. So I got these tabs, Doctor. So that's my little strategy.
Yeah, I think I'm going to have to try that. That makes a lot of sense. Okay.
And I want to thank our audience for joining us tonight. I want to thank Dr. Sacher for being so generous with his time tonight and sharing his great story with us. If the audience, if you haven't done this already, please donate to the AJC Decatur Book Festival. On the meeting application that you're in right now, there should be a button that says support the Decatur Book Festival. Please click on that and give if you could. Doctor, thank you so much again. Everyone, enjoy the rest of your weekend. I really appreciate it. Take care, everyone.
Thank you, Jeremy.